My name is Terry, and I'll be doing today's presentation. I'm a project director with iplanit. I come from a social care background, particularly in person-centered planning, predominantly within learning disability support services, but also floating support and some complex services as well. But first, if this is the first time you've come across iplanit, let me just quickly give you an overview. iplanit's a flexible and modular cloud-based system, so that's quite a mouthful. What that means is iplanit is on the internet, and you can tailor iplanit to meet your needs. It's not kind of like a cookie cutter system. We adapt it and change it and configure it to how you work. There are modules you can add on or not use, depending on what your needs are. It's not specifically around learning disability, although back in 2011, when we first started iplanit, 2010, 2011, it did focus on learning disability, but that footprint has really expanded now because of the principles of the iplanit system, which I'll show you in the next slide. But at the moment, it's enabling thousands and thousands of support workers and care support delivery and service leaders across the world to deliver on their promise to the people they support, which is to improve people's lives. It's a tool to help a provider organize itself so it can help and improve the lives of the people it supports, keep them safe from unnecessary risk. It offers transparency, which we'll have a quick look at today, to the loved ones of the person supported. They can access their plans and outcomes, track their own progress. So there's a real enablement aspect to it as well. And then behind that, as that is happening, behind that, there is lots and lots of powerful reports that iplanit can generate, which can really help validate your services, help funders see where the value for money is, help you organize yourself as a provider. So iplanit is kind of founded in person-centered practices. It has an integrated approach to what I was saying before, evidence and value, capturing impact, outcome reports, and so on. So evidence and value at the point of support and being able to put that into powerful reports at a management level. Inclusion, so people can access their own plans, they can access their own outcomes, they can track their own progress. There are calendars people supported where patients can access. There's lots of different ways to include it. Family can be included as well. So there's a real, which leads on to the next point about transparency. Now that's transparency with family members and with the person supported, but also in and amongst the organization as well. There are notifications. It helps collaboration, the risk management is there as well. And then finally, that leads on to accountability. So, there are things that we need to do, and we need to say when they're done or why they've not been done, or what direction the service is going in, both on a direct support level, on a mid-manager level, but also on a strategic level for the organization. So these values we have about evidence and value, inclusion, transparency, and accountability, these are the values we've based iplanit on, which is why it's not limited like it originally was to learning disability. It has a footprint that expands to any high quality support. And this shows how systems, those things I've just read out on the bottom there, how the system can really help propel values, that can help support values. We don't like to think of iplanit as just a computer system. It really is a tool to help progress the values of the organization, to help that accountability side of things, that can really help the values of an organization progress, but be accountable to them as well. It's not just a paper exercise. So if we had like a bird's eye view of iplanit, it would look like this. So the circle in the middle is what we call core iplanit, and that is what every rollout of iplanit gets. So any provider who starts to use the iplanit service, they get those center circles as the core iplanit, which covers a lot. So firstly, it covers plans towards the top right there. You can upload documents and document management workflow. You can put your own systems into iplanit. It tracks outcomes, which, if it goes to the opposite side of the circle, leads into the key performance indicators. Those two things can be linked together, the direct support aspect of outcomes and people achieving their goals and dreams, and support being delivered to deliver safe support, and all the things that you need to evidence on a direct support level, but also on an organizational level. So the outcomes and KPIs are linked there. There's an alert panel, keeping everybody informed, letting you know if some things are overdue, letting you know if something needs to be signed off, and things like that. There's an internal messaging system, a dashboard, which is generally where staff spend most of their time on iPlanet. We'll have a quick look at that today. I'll show you what that is. And that is really helps the staff member, whether they're a direct support worker or a senior manager, helps them organize all the information that's on iPlanet. Because there is quite a lot of information that goes on there. There's a filing cabinet, so if there are things like tenancy or GP notes or anything like that, you can upload those documents and there's somewhere safe to put them so that you don't have lots of multiple systems. iPlanet really can become a place that you can put a lot of the information around a person. And then the outside circle are the kind of the add-ons, the modules that you can add on. So we're going to look at the top one today, referrals. I'm going to briefly show you around needs assessments as well. So there's a lot of thought gone into how we can put information onto iPlanet and how that can kind of reflect and really be a useful tool rather than a burden for your organization. But let's jump onto the system very quickly. So if you've not seen iPlanet before, this is going to be a bit of a whistle-stop tour, but jump onto other webinars or have a look at our website, and there's a lot more information there that we might not cover today. But the webinars, generally the webinars, we do one a month, so we can show you a lot more on other webinars. I'm just going to jump onto Harmony. So these are the people I support in this. This is all a test system. These aren't real people. So these are the people I support in this example in this training system. Harmony is one of them. So if I just go to Harmony, now if I go to here media, we have this is where all of the pictures and files and sounds and music and to help really make a plan come alive all up here. But then we go to documents. Or there could be external reference or support procedures or safeguarding. All providers configure this. If there are always documents that aren't necessarily going to go onto iPlanet, it actually needs to be a document and it gets emailed or kept on file. Sometimes that's something like medical notes or a tenancy agreement or something that is from an external agency, and it needs to be kept in that format, and therefore it's not really going to go onto iPlanet. Where do we put that? Well, iPlanet, you can configure iPlanet to support you can upload it and have it on iPlanet, so it's all in the same place, and you can upload whether that's PDFs or Word documents or whatever you're particularly using. So that's just one aspect of it, but the main one is around plans. So if I go to create a new plan here, I'll just show you an example. So this is where we make a new plan for this person, and we have the sections here. So this is a plan called the big plan process. It's a test plan. Who's part of the big plan team, about the person. Here's all the sections here. But then if I change that, we have other plans. So we have an outcome support plan, and those sections become different. And this has a needs assessment in it, which we'll have a look at in just a second, or a support plan. So this is just an example, and all of these are configurable. So these icons here, these are configurable to your icon, so we put yours on there. The sections of the plan would be the sections as you use them and as you have them. So there are lots of different plans. We already have a lot of templates on there, but generally we found every provider has their own way of planning. That's what differentiates them. So we design a plan on iPlanet to reflect that. So let's just jump back and have a look at an actual plan. So if I go into active plans, and here's Harmony, and it's been reviewed 5 times early. It's been reviewed twice. Like there's lots of things we can do here. There's some notes about the plan down here. We can print it as a PDF and so on, but it's not really what we're doing today. So I'll jump into the plan. Here's another type of plan for Harmony. And if I jump into the first section, all about the person, this is a very simple section. It's just information that's added in, and that's it, and we can preview that and what that looks like on the portal, the person supported side, and there's media there and so on. But here, this is a very, very simple plan, but providers will have other sections of the plan that will be more involved. So let's have a look at one of them. So if I jump to, say, food preparation and menu as a section. And again, you know, the plan is designed around your plans. This is just an example. But we have a category here. We can add an outcome to it. So if I was to add new support, I can start to categorize some of them things about cooking meals. I can put the support need in there. I can say whether we need something that's trackable as an outcome, you know, like a bigger life goal in there. Or I could right click and I could create a task. Now this is a module, this is an add-on module. We can create a task from there and start calling the task, you know, go and eat 3 healthy meals, and we want to track that. So if we were to look at what that would look like, let's jump here. So there you go, meal plan, assist how many to put, so that a staff member gets a reminder for that, and they're told, you know, they need to tick off that they've done that. And that's kind of a daily task. So that's not really an outcome. The outcome is the bigger life goals. The tasks are kind of the day-to-day things, about usually about meals or personal care or medication or things like that. What I'm showing you here is you can configure your plan to do pretty much whatever you want it to do. So we had a very basic plan section, but now this one's a lot more involved. We also have the risk management in here. So if we so this is the risk assessment with the scoring. And then if we were to add a risk, we get a little drop down here. So these are that you would add these risks. So there might be risks that are very specific to the type of support that you deliver, or the risks that the people you support have to face. And you know, you would configure this to reflect that support. So we have a very long list. You can use that, or you can just add your own. And then there's the scoring side of it. It can be slightly configured. So I'm just kind of giving you a flavor of how you can change lots of different things. So that's just very, very quickly in the time we've got looking at a plan. But if I was to jump back, just kind of some of the core things, like on a day-to-day basis, if I went to support notes, you would design these support notes, because not everybody records support in the same way. Every organization has different ways of recording support. So if I was to jump to like a daily support log, let's make a new note there. We have, this is called shift times, and we would just mark the shift. There might be, there's a log date at time, the support type that's been delivered, describe it, and then these boxes here. And these boxes are very configurable. You can change these to reflect how you currently record support delivered. This is just an example of that. So this all comes part of that. Remember them stages 1 to 4 I was talking about? This is the thing, these are the things that we would work with you on to make sure that when staff look at this, it looks like their paper system. It just becomes much more powerful because it goes into an online system, and you can gather really, really effective and powerful reports, which kind of show that value for money, or they show the impact on the people that you support. They give you that transparency and accountability. So there are lots of different, this is a full spread here, but you might just want 1 or 2, like a contact log, for example. If we were to make a new note there, you can have different contact types and so on. So the notes and logs, very, very configurable to how you want to record. And then all of that, once you've decided that, you start to see then that these things can go into reports and your decisions that you're making. So here's all of the shift records, take you through that. So you're not just designing things on the front end, you're also saying, well, what's the usefulness of this in a report? This is a very, very simple example, but I think it really highlights you can configure things, you can turn them into a report. You know, new shift records, and really seeing what it is you need to see. So you've not got any kind of superfluous information, because you're at the front end designing that with us, and the configurability. You know, without being a pun, you're keeping it real, you know, keeping it tied to what it is you do. So let's look at, you know, before we run out of time, another core thing we deal with is outcomes. So it's very, very important that from the plan, certain outcomes are developed, the goals for the person, and just little things as well. You know, you'd have your logo up here, for example. You can rename some of these. You know, the activity dashboard might not suit your culture. You might not call outcomes outcomes, you might call them goals. You know, that we can configure a lot of that so that the language, which is a lot of the language used in support, is what differentiates the provider. You know, there's a lot of that we can change in there to really reflect, you know, what makes you as a provider unique. But if we jump into outcomes, I won't go into this in too much detail. I just want to show you an aspect of outcomes that is really, really effective in terms of configuring when we are rolling out iplanit to organizations. So these are the outcomes here. So here's one: I have a volunteer job, that's the outcome. This column here is a bit more information for the provider. So here's one: I would like to regain some confidence in myself, I'd like to live with less fear. That's the outcome as Harmony sees it, and then there's some information here which only the provider sees, just to give it a bit, you know, in case we need to use some provider speak to kind of explain that. Harmony wants to regain confidence, self-shared, and wants a person called Dawn, she wants to feel better. We've got some notes around that. You know, Harmony enjoyed a confidence class, but needs lots of encouragement. So there's a lot of great functionality around outcomes, which we'll cover in another webinar. But what we do with outcomes, which is really important, is we link them to key performance indicators, so that when, like up here, we get a tick that this has been done, going to meditation every Friday, that's an outcome that's been achieved with Harmony, and that's great for Harmony. But we also need to do that, you know, value for money, evidencing the impact to outside bodies and internally as well. We need to be organized around, well, what is the impact of our support across the organization or in areas of the organization? So we link these outcomes up to key performance indicators, and I think this is a really good bit of configurability on, which is a very popular part of configurability on iplanit, which is if I was to wanted to add a key performance indicator, this has lots of key performance linked to it on the left. So this box here is showing me all of the key performance indicators that are linked to that outcome, so that when we get that outcome gets a tick, it sends it to a larger report, so that we know a certain key performance indicator, like this one here, is being, you know, we have an evidence set against that. But on the right here are all of the key performance indicators on this particular system. So CQC is one that's local to me. I'm in the UK. So CQC is the Care Quality Commission. Chloe is Key Lines of Inquiry, and that's kind of the government's inspectorate in England, which is where I'm based, and these are the key lines of inquiry. So this is just an example. You don't really need to be familiar with this, but these are key performance indicators, KPIs. We put them on the system because it's relevant to that area. So let's say Harmony is supported in England and the UK. This is the inspectorate, so we've put that on there. But then we have other ones up here from different regions and different countries, the HICWA for Ireland and so on. And if these on here are just the external government key performance indicators. What a lot of providers do, and what we encourage them to do, is have their own set of key performance indicators. So firstly, it's very, very good that we can kind of very easily drag this key performance indicator, drop it in here, and then people are supposed to make choices. So we'll get an evidence set or a tick in that box. We'll get some that we can kind of drill down into the details, which I'll show you in just a sec. So it's great that externally for our inspectorates, we can give them really detailed, up-to-date as of that day, reports. That's really, really great. But also internally, if we have our own set of values, our own key performance indicators, we can put them in here and we can link our own key performance indicators, which is usually kind of like our charter or our, you know, the provider's values or their mission. They can kind of easily break that down into key performance indicators, so they can see, as an internal exercise, how the staff, the outcomes, and the impact is measuring up to the organization's own goals, as well as the external ones. And all of this is kind of linked to this one. I mean, this is a bit over the top. This is a training system. You probably wouldn't have that many key performance indicators linked to one outcome, but it's there. But we would jump to the reports, jump into performance reports, and let's close this. And then it gives us kind of the statistics of, if we just jump to CQC, which is what I was focusing on, supported to make choices. We can see there are 25 outcomes linked to that key performance indicator. 2 are in progress, 15 we've done, 7 we didn't do. So I just drill down into that. We can see the reasons that staff have said that these have been achieved. there might be some notes. Yes, somebody's changed their mind. So these are the reasons people, staff have said outcomes have been achieved. We can drill down into who those people are, what location they're in, or we can just kind of say, well, let's just look at the KPIs for Dublin or North Tipperary, or if we're over here, let's look at Chester, or we could do it by service if it was residential, and so on. But that's just kind of going into reports a little bit, but just to show you the value in configuring your system to reflect how you work, from the plans to the outcomes to the notes and logs to the key performance indicators, and then onto the reports. So I'm going to leave that there. Thank you very much for joining us. I don't want to take up any more of your time. Thanks for hanging on and listening to that. Go to our website, get in touch with us if you want any more information. And I'll leave it there, and I hope the rest of your day goes great. Thanks very much for your time. Cheers. Bye-bye.